continues beyond inception and birth. And each new day, the wonder of our creation is seen as the human body works at restoration healing. Go with us on a journey of discovery. Learn how you can enjoy an abundant life, living in harmony with the divine laws of nature and healing. Join Danny Vieira and Junie Lawson in Adventures in Health. This week's presentation is titled Natural Remedies for Children.
Welcome to Adventures in Health. I'm Junie Lawson with White Horse Media, and this is my good friend Danny Vieira, Director of Modern Manna Ministries and the Bella Vita Lifestyle Center. Danny, this program is titled Natural Remedies for Children, and I think you might be something like an expert in that area. I know you have 5 kids, and you've raised them in a healthy lifestyle. How many times have your children been to the doctor over the years?
Well, you know, I've never taken them to the doctor, and for many, many years, I could say they'd never been to the doctor, but there was a time where my wife had gone and checked out an earache or something, and the doctor wrote her a prescription, and that was fine with me. It's just that there were things that I continually learned about what to do naturally, you know, and when I learned those new things, then I could try something new. And so, you know, rarely have been. My son is 20, he's 21 years old now. He's never been to the doctor. You know, he's never had a medication. He's this spit image of health, and like I said, I think my oldest daughter, she had an issue, but we couldn't help. But other than that, you know, they went when they were cut open and they had to get, you know, stitches, and I think there was just 1 or 2 times. I mean, like 3-4 times out of 5 children in 23 years. Yeah.
So you taught them as they were growing up not only how to eat healthy and follow the 8 laws of health, but did you teach them what they could do?
You know, I don't even tell them what to do now. I mean, I got a call from one of them and said, Dad, I'm having this problem. Is there something I could do? And I said, yes, here's a natural thing that you can do. And she said, thank you. But most of the time, even my 9-year-old child will go into the herbal medicine chest and take the things out she needs, whether it's garlic or it's charcoal or it's some herbal remedy, and they know what to do. So it's incredible to see even children become educated at a young age to find that God has healing remedies on this earth.
That's excellent. I know that there are a lot of parents that are watching that are very interested in hearing what they can do to help their children. And we've talked about a lot of things today, but one of the things we talked about is when your children were young, when they were babies, what was the first food that you fed them other than, you know, mother's milk? Did they eat cream of wheat, farina? What was it?
That's a great question, because so many, I believe, mothers think they're feeding the child the right food initially that sets them up for allergies the rest of their lives. So I read a book that it's not in print anymore, and it's called How to Feed Your Child from Pregnancy On. So while that baby's in that womb, or that fetus and that embryo and that, you know, young infant's in the womb, you're feeding that child indirectly through the mother, correct? And so I began to read, and so, you know, my wife would eat very healthy things, and she'd get high quality nutrients. She'd even take kelp tablets to get 80 minerals into her system, and we were reading, and then when the baby was born, breast milk was so important, all right? And the bonding and the nutrition. So the mother was feeding too, not only herself, but the child, and what she ate is going to build the breast milk. That's something you always want to remember.
So she needs to be careful of her diet as well.
Most important, yes. And so you have the breast milk, all right? And what we would do is, I read where brewer's yeast would nourish the breast milk, drink enough water and all of that. But when the child was at the point to start eating solid food, and you know, I think she went a year with the first child, if not a little longer, and 6 months typically you bring in food. I think people introduce it too soon, but the other thing is when they start getting some teeth, that's when you want to bring in the grains, like you mentioned, farina. So the first food, let's say at 6 months, was fruit. And this doctor who wrote the book, was a pediatrician, said start with one fruit, like a banana, and smash a ripe banana and give her a few tablespoons, and that's about it. See how her digestive system works and look for any allergic reactions.
Introduce one thing at a time.
One thing at a time, and then apples, and you don't have to get it in a jar, but you can have the enzymes intact, throw it in a blender with a little water, and bzzz, and then you got applesauce, all right? So we would do one food at a time, and for about 4 weeks we'd do the fruits. And then the next 4 weeks would be the fruit vegetables, we'd call them, like the things like peas and squash and zucchinis, you know, those things. And then the 4 weeks we do those, and then 4 weeks later we would do the vegetables, the cauliflowers and the broccolis and the carrots and things of that, and bring in the potatoes. And then when the teeth started coming in, so are the starch splitting enzymes, because they're going to mix the food now in their saliva.
Okay.
And that's when you brought in the grains. And I always say wheat last.
All right.
You know, start with rice.
Okay.
Because so many people are allergic to wheat. So once you fed them this way and then supplemented with the mother's milk, you know, or at that time they're eating solid food, they can go to other types of rice beverages or things of that nature.
And what about the breast milk versus some of the formulas that are out there?
I always say, you know, God did it right, you know, to feed the child milk from the mother in any species of animals. And the formula is very high in sugar many times, and children can have allergic reaction to those too. But certainly if they can't breastfeed, then you have to do the second best, you know.
Okay.
But anyway, I was going to show you a couple things too, as some natural remedies that I did with the children when you're talking about dairy products. A lot of earaches.
Yes. And what can you do for ear infection? I know my children had ear infections. I heard many say they have that.
Well, I've learned that in the 95% of the mothers that have come to talk to me about their children and ear infections, I find it's gone by eliminating all dairy product. Secondary, wheat, but primary, dairy products. Because lactobumin is the predominant protein in mother's milk. In dairy, it's casein. So with that high amount of casein, you know, and they'll use it even in wood glues, and the percentage is wrong. And so therefore the body attacks that protein like a foreign substance and produces more mucus, and then they start getting ear infections. So I developed, you know, an idea here. I know garlic is a powerful infection fighter, and I developed a way to use the garlic, and typically you want to find a small clove. Let's see if there's one. Here's one. We'll use a small clove like this, okay? And this is a power infection fighter, but it contains allosulfites. And the sulfur can burn the skin with garlic. Garlic is powerful as an infection fighter, but it can burn the skin. So if you peel it and you put it on it, ow, it's too hot, and you can irritate the skin. So I learned a very simple technique, and that's I just cut off the end like this. Now you have the chemical compounds in the garlic that are going to kill bacteria emitting. You have the protection with the skin all around it, and simply stick it right in the ear canal like that. It's not going to, just like that, and I leave it there, and I can smell it so strong, I can taste it.
You can smell it with it being in your ear.
Powerful right now. Very, very strong. And I even use it on myself. If I eat peanuts, I get an earache. And I'll put a clove in like this, I'll go to bed, and I'll just sleep. In fact, I'll wake up, and typically every time with children, it works. I'd say it works at a very high percentage.
Would you use that also with an infant that, you know, was tugging
If there
at
was
their
an
ear?
ear, yes, absolutely. It's not going to harm the infant.
Okay.
And like I said, the important part is keep it covered that you don't burn the skin.
I see.
In fact, I had a mother that heard my radio show, and she said, you know, I heard you talking about onions and garlic for earaches, and I thought you were the biggest quack out there. She says, until my children left my granddaughter with me and went on a vacation, and she got an earache. And it was late at night, and I said, that guy on the radio, he said, take an onion, cut it in half, and this knife's a little small, but...
Yeah, sorry.
Okay, so you cut an onion in half, right? Again, there's powerful antibiotic properties in this onion, all right? So I told her, put it in a microwave, turn it on for 2 minutes, 3 minutes, and it starts sweating, and it's softening. And you can smell the aroma, right?
Yeah, I can smell it.
You want it to cool down. You're not going to burn their skin. And she said the child was there. She was tugging at her ear. She wasn't feeling well. She got the onion, She put it on. I said, wait till she's sleeping. She put it on her ear, or as she's awake, and just set it there like this. And she said the child fell asleep. And she says when she woke up a couple hours later, there was no tugging, there was nothing. It was gone, and she called me to thank me. All right? I will use some herbs, and there's many herbal formulas that are out there that are very powerful. And this you can do, leave it on a couple hours. If you do the clove, a couple hours, even while they're sleeping. But there's natural antibiotics in these.
That's
This
awesome.
produce, and it's a very simple remedy. And I say, do not, say, oh, my child has an earache and a fever, and therefore I'm not going to the doctor. I'm just going to do this. I always say, do what you need to do. Consult your physician, and you don't. I have a story where one lady, not by my advice, but she said, my daughter has an earache, and I'm trying natural things, and I'm going to hold out by faith, and the child went deaf.
Oh, that's terrible.
And so I want to warn people, don't ever think that, you want to consult your physician and make sure you do. If you're not having the results you want, don't ever jeopardize the person or the patient or the child. I think that's important. And this is another herbal product that I use on my children as they were growing up. And it has in here, it's the number one ingredient. There's mullein and garlic, but there's St. John's wort. And I had a story of a mother who brought in her child to see me and repeated earaches, recurrent earaches, over and over and over. And I educated her about getting rid of the dairy products. And she goes, okay, he's been on antibiotics for years. And the child just kept having earaches. And he came in and he had some tubes in his ears, in fact. And I said, well, here, to the mother, just take and put in 2 drops of this. It's very healing. It helps pain. And it's going to help the bacterial infection in there and everything. And I'll never forget it. She laid the child down on the lap and would put 2 drops in the child's ear like this, and he was screaming and pale, he's fevery, and he went, ah!
It helped.
I'll never forget that. And in 1 week, she brought the child back, said, no dairy, no fevers, his ears are clear. He's never gone, days without some problem with his ears, and couldn't thank me enough. So I always keep this in the herbal medicine cabinet.
You said that has St. John's wort in it, and I've heard of that used for depression, but what does it do for the
pain.
ear?
It works with pain, and I think that's why the child felt the instant relief, and it was very beneficial for him. So you have onions, you have garlic, you have herbal remedies for the earaches, and then correct the diet. So that's very powerful, and that's one of the things that plague parents a lot while they're going to the doctor's earaches. So there's some great
then
things.
What about stomach problems for children?
Stomach problems, again, I think, figure out what they've been eating. Too much sugar, too much pizza. They're not going to the bathroom. So many times, honestly, I look at my children when they get up in the morning and say, I have a stomach ache, and I said, have you gone to the bathroom? They said, no, and I give them warm water.
Yeah.
That's all I do is say, drink this warm water. Then the next thing, they're in the bathroom. Then they come out and they say, my stomach ache's gone. There are herbs. I look for formulas again. There's a lot of cleansing products and colon cleansing products out here. But here's something I found for children with prunes and figs and fennel, a little senna in there. It has some wild cherry in there, some ginger and orange peel and Turkish rhubarb, cascara. Those are herbal laxative type substances, and the figs and the prunes. So whatever it takes. So many times their tummy aches are because they're backed up. I'd have mothers call and say, my son hasn't gone to the bathroom in a week, and it's almost a crime.
Don't go away. We'll be right back. Today's offer, Health and Healing for Your Children, is a great resource for families. Learn practical methods for helping your children stay healthy. Order your copy of the 4-part audio CD series for only $19.95. Ask for offer 109 when you write or call. To order this practical series, call 1-800-655-3228 or write to Modern Manna Ministries, 519 South Central Avenue, Lodi, California, 95240. Ask for offer 109 when you write or call. The audio CD Child Obesity addresses a serious problem facing families with overweight children. Learn what you can do to help your child overcome this tragedy and what diet to follow to avoid serious health problems later in life. Order child obesity for only $6. Ask for offer 209 when you call 1-800-655-3228 or write to Modern Manna Ministries, 519 South Central Avenue, Lodi, California, 95240. Now back to Adventures in Health.
I'd have mothers call and say, my son hasn't gone to the bathroom in a week, you know, and it's almost a crime. So, you know, you want to assist nature again, and everyone knows about prunes and prune juice, right?
Right, yeah.
Try it with your children.
Yeah,
you know?
what if they feel nauseated, have an upset tummy like
I
that?
use the charcoal. I think that's one of the best. Again, I'll give them like chewable tablets, or I'll mix it in water and just tell them to drink it down. And charcoal works quick. You know, it's easy to take, and it's just, I think of it, you know, their body's fighting something, and this is going to go in and suck it into itself and then pass it out through the body. So I think that the charcoal is another powerful one. And then I use herb teas on children, you know. I'll get certain herbs. Chamomile's a good one to soothe their stomach. Ginger, peppermint. There's ginger peppermint blends. So I'll use something like that. A hot water bottle on the child's stomach is very soothing at times.
If they're nauseated, or is that for pain?
I would do that more if there's cramping or if there's pain type things. But for nausea and whatnot, I'll give them lots of water, lots of liquids, make sure they're evacuating, and charcoal. Charcoal is a very powerful one for the children, yes.
You mentioned sugar, and I know we had talked about that so many times after a holiday, after Thanksgiving, or maybe it's after Halloween, or when the kids have had a lot of sugar.
It affects their immune system so radically. I mean, as I said, you know, there's those white blood cells. I always tell the kids, think of it as little Pac-Men, chomp, 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 and they're going to eat the bad guy. And so what happens? Here's what happens to your white blood cell. Chomp, 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 chomp. Chomp, chomp. It slows down. It can't eat it up and digest it and break it down. Your immune system's impaired with the more sugar you eat. All right? So I try to educate parents, you know, not only is it rotting their teeth, you'll save a lot of dental bills, putting on unwanted pounds, it's weakening their immune function. And so I try to steer people away from the sugar.
And it's not just the kids, but the adults that get sick after
Maybe they're the problem.
after a lot of sugar too. Then we talked about sore throats.
Sore throats, again, you know, I have the grapefruit seed extract that I showed in the last show. A few drops, I have them gargle. They don't like it. They fight me and they say, it tastes terrible, I can't stand it. I said, just gargle it and spit it out, okay? And I can get them to do that. That stuff, typically, that day it's improved, or the next day gone. You know, the other thing I'll use is again the colloidal silver, and I'll do, you know, if they're having a little stuffiness and sinus problems, I'll just get this one and because it's a nasal spray. They suck it up, doesn't bother them. There's no flavor, there's no taste or anything. So I think the grapefruit seed extract's very good. I think the colloidal silver again is very good. Even I'll get a cloth, you know, and wrap their neck at night and wet it in cold water so that the body's going to heat up in that area. So when the blood comes, there comes more healing, all right? So anytime the throat, the head, make sure they're evacuating and they're cleansing their large intestine. Then give them some herbal remedies. They can gargle, you know, some people gargle with a little bit of lemon and, like I said, and honey, and you make a little syrup and let them swallow it. Even honey's soothing to the throat and healing.
Is the old salt water remedy?
I think it works. You know, I think it has value, but I won't use a typical salt. I'll use a good salt, like the Celtic salt with 80 minerals in there, something of that nature.
Okay.
So that's very valuable too.
Yeah, and it's really important to boost the immune system, isn't
That's
it?
the next subject, yeah. And again, I look for herbal products. You know, you can find them in any health food stores. Typically, there's herbal children's lines, you know. I've been in the health food business for years, so I've seen different ones that come and go, but I would advise the listeners to find one with echinacea in there. I think echinacea is a very powerful herb that stimulates an immune response. And you know, this is like a children's glyceride, and this product I think has great value because not only does it have herbs to stimulate the immune system, but herbs to support the respiratory system as well. So when they're coughing and their chest is affected, or a chest infection or something going wrong with their lungs. An herbal formula such as this one here, it's interesting. It has in here Herba Sante, it has elecampane, it has osha root, it has wild cherry bark. What do you think of that? Wild cherry bark, natural cough suppressants. Cherry flavored cough syrup, okay? Wild cherry bark. You have echinacea in here, you have mullein. These are all good for the lungs. Golden seal, there's a natural antibiotic. Ginger is good for circulation, it's good for calming down the stomach. It has orange, lemon, and in there, and it has some honey, and it's a vegetable glyceride.
Okay.
So it's sweet.
That's good.
So they taste and go, oh, that's pretty good. So you're stimulating their immune system and helping their respiratory system at the same time with something like that.
Okay, now you mentioned to me a story about a Christmas party, and there was a little 3-year-old boy at the dessert table. Tell us about that.
Yeah, here's something else too. You asked, did I bring my kids to the doctor much? No. Did they ever vomit? Yes. Did they ever get sick? Yes. But I found out a number of things. I took an herbal symposium course on herbal pediatrics, and it was very interesting to me because I have kids. But here was this Christmas party, and I was watching this little toddler over there having a free-for-all at the dessert table, and he's picking up the pies and the cakes and the sugared donuts and the Coca-Colas, and he didn't stop. And I said, boy, this is really entertaining for me. And pretty soon he's walking around and everybody's socializing, and he goes, and he vomits and all over the floor, and everybody panics, and they're going to bring him to urgent care. Oh, something's wrong, he's sick. And I said, I'm the weirdo, right? Because I'm in alternative healing. And I said, could I say something before you do? I said, I've been watching little Johnny there for the last half hour, gorging on all the sweets. He must have 100 teaspoons of sugar in him right now, and his body's natural defenses to protect him were working very effectively in that he heaved it all up, Junie.
Okay.
And you know what? I said, before you take him to urgent care, look at his face now. He was smiling. He was happy. He was laughing because nature did its natural remedy, and that was the vomit.
So the bottom line is be observant of what they're eating and what they're doing, because that might be the underlying cause.
And don't always think that I believe in caring for your children, but I don't have to rush them to urgent care all the time. There's some simple things, and the body will correct itself. Certainly, I'm saying be responsible as a parent, take care of your children, but become more educated in simple things, because I learned there's natural things you can do for the child to assist nature in the healing, and also if you give it a little time, the body corrects itself. If it's something serious, of course, get a diagnosis, find out what you're dealing with, be responsible.
Okay. Maybe you could tell us, too, about the 12-year-old boy you mentioned that had a problem with the spleen.
I believe God was really working with that. He had an enlarged spleen, and he was going to go in for surgery. And the mother came to see me and said, is there anything he could do pre-surgery, or, just to build his immune system or whatnot? And I said, well, what's the problem? She says, he has an enlarged spleen, and they're going to take it out. Well, I don't think there's any extra body parts that we can we can lose without some consequences. But why I say I think it was a divine appointment was that I had just finished a radio show on my program I was doing at the time, Healthline, with Dr. Lennon Smith, who's a medical MD pediatrician into alternative care. And he said in his program and in his book, it was called Beyond Antibiotics. And it was saying in that book that one of the side effects of an abuse of antibiotics in children is an enlarged spleen.
Really?
And I went, I just talked about that yesterday. And I said, has he been on antibiotics? He's been on antibiotics throughout his life, ear infections and colds, and he seems like he's always on an antibiotic. I said, well, one of the side effects of an abuse of antibiotics is an enlarged spleen. She says, well, what can we do? And I said, well, consult your physician, but here's some things that I've done on my children, all right? Build their immune system, get rid of the sugar, take some herbs that build up the body, get some probiotics instead of antibiotics. So we flooded them with Lactobacillus acidophilus. We got the sugar out, the dairy products out. We gave them vitamin C that's antiviral. We gave them echinacea, golden seal, and I gave her some other tools that she could use. Never had the surgery. Spleen shrunk down to normal size, and I believe it could have all gone back to the dairy. To be the initial problem that set him up for the recurrent earaches, that brought on the abuse of antibiotics, and enlarged spleen. See what I'm saying? Ascertain the cause, but the cause may be dairy.
Yeah, so we need to get back to what is the root, what is causing this,
And get it
instead of
out.
just keep going through the cycle and the cycle over and over
Exactly.
again. Yeah.
You know, and something simple for if they cut themselves or whatever, peroxide, yes, but tea tree oil. This is from a tree, and it's very powerful antiseptic, says right on it, tea tree oil antiseptic. And my children have learned to use, you know, clean it off with the peroxide, you know, tend their wound, but this is, you know, instead of maybe iodine or something, I'm using tea tree oil, and it's a very powerful antiseptic too.
And was there anything special about this one for the kids?
Well, the colloidal silver, I think I touched on it earlier. It's just in a simple form where you can spray it into their nostrils, you know, and it fights infection further. Because typically with children, you're going to see stomach problems and colds and flus and respiratory illnesses. That's typically the things you're going to see. So I'll associate it to the backed up intestines. They're eating too much sugar. They're drinking the dairy products, things of that nature. So.
Okay, well, Danny, you've given us a lot of information already, but could you wrap this up and give the viewers a summary?
Sure. Well, what I would say is I would just continually to get educated, and if you have children, there's a lot of natural remedies that you can do, that you can get these herbal things and go to health food stores and seek out the advice of somebody that's a natural doctor. And it's really nice to know that God has given us things on this earth that are very powerful for healing and very powerful for aiding the body when it's trying to fight something that's ailing it. Okay, so there are wonderful things that you can do, Junie, to take care of these things.
Okay, Danny. I know that the parents out there, the moms, the dads, and the grandparents are really going to appreciate all of the things that they've learned here. And you may have to do what I'm going to do, and that is go back later and get the DVD so I can take notes and watch it again. But we want to thank you for joining us today for Adventures in Health, and remind you that our next program next week will be on women's health. And not only will the women want to watch this, but the men too, because maybe you can learn something to help your wife. Thanks for joining us.